Your clients are coming to you because their body is communicating that there's an issue. Are you listening to what it has to say? If you struggle getting the results you want with your clients or helping your clients improve beyond a certain point, then don't miss today's episode as I share my tricks of the trade that will not only get you desirable results, but that will pull in the pieces that you may have been missing. You know, the ones, the little thoughts or pings in your body that tell you you can do more and there is more to this work. Well, I'm here to tell you you can and there is. When working with clients, there is so much more to working with the body than just following the protocols that you've been taught. Listen in as I share a recent case that involved working on a client's cervix and the additional data you need to be watching for in all of your treatment sessions to attain more meaningful results. Keep on listening if you're ready to add in the missing pieces and improve client outcomes. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody. Welcome to this episode. And today I wanted to share with you something that came up this week as I was working in the clinic and working with someone's tissues. I was actually internally working with her. And for those of you that have taken my courses, know that I'm teaching specific techniques to be done in a certain way. And one of my big philosophies is to give the tissues what it needs. And I was working on someone's cervix today, and it wasn't that they needed how I taught. So I was thinking about this as I was working with her, and I'm going, boy, I hope people know that the techniques I teach are taught because that's anatomically why, structurally, the direction and forces that line up for what you're trying to make an effective change in the tissues. So I'm teaching you the direction and forces as it should be anatomically in the body, but sometimes the body needs something just a little bit more or a little bit different than the way I'm teaching it. So please learn the techniques in the way that I teach them, but also increase your skill in being able to really listen to the tissues and get a sense of what the tissues want and need in order to release. So I was working on this person's cervix, and it didn't need a direct side to side motion, which would be the cardinal ligament. And it didn't need the diagonal to the back, so the lateral posterior force that is the uterosacral ligament. It kind of needed this funky little oblique, maybe motion or pressure on it in a way that anatomically doesn't make any sense. But when you tune into the tissues, it's like this is the direction that the tissue wasn't willing to go. And it didn't feel like taking it into the opposite direction was what it wanted, but it actually wanted to go more into the direction it didn't want to go. And that comes with skill, that comes with experience, that comes with listening to the tissues to give the tissues what it really needs. And so I'm giving you permission to go beyond the techniques in the way that I teach if that's what the body needs. So know and understand the techniques in the way that they are taught so that you can anatomically understand what we're trying to do with each and every technique. But then set that aside and be present with the tissues to see exactly what the tissues actually need. Okay? So this is your golden nugget for today, your reminder to pay attention to what the tissues need and work with figuring out a way to help give that to the body. Okay. So please give the body what it needs. It would be so grateful to you. And another fun thing that happened today in one of my sessions was this person was postpartum and only 2 weeks postpartum, and she had a lot of pain in her second pregnancy. And it was actually the ramifications of the first birth that actually went great. But as I was tuning in and I just held the sacrum posteriorly, she was on her back. And at 2 weeks, her fundus still felt, it was definitely below the umbilicus, but about halfway between pubic bone and umbilicus, and that's where it was sitting up. So it was still enlarged from the birth. And I just kind of compressed it front to back, but a little bit more on the right-hand side. And it was so fun. This client could just feel, and she's like, oh my gosh, I have more blood flow going down my right leg. And I was like, great. But that wasn't like that's just tuning in and giving the tissues what it needs. And to be perfectly honest with you all, when I started developing, when I was doing this work before I started teaching it, sometimes I had no idea what my hands were actually doing on the body. It wasn't until I started teaching it that I had to figure out what my hands were automatically doing with the tissues on the body. And then I figured out what was happening most of the time, and that's what I am teaching in the world. But a lot of times it's these one-offs that it's not all the time that it happens, but this body just needs this little tweak. This body needs that, this tissue needs this little tweak. And that's where your intuition, you paying attention to what the tissues need and figuring out a way to give that to them. Okay? So have fun with this. That's what makes this work so fun when you're working with the body, that you can just give the body what it needs. And what I was going to share with that client, that pregnant client that's just 2 weeks postpartum, is that it's, when I said out loud, it just feels like your uterus and your sacrum need to understand their connection. Or I said something about them, and it's like her whole body, just saying it out loud, what I was sensing in the tissues just helped her tissues just to relax. So it was so fun and so cool, especially when they can feel those cool releases in there. So give this a try, you guys. If you haven't taken my courses, please feel free to check them out. And if you have any questions on those, please reach out and have fun. Give the body what it needs. Let the tissues, listen to the tissues, and let it guide you. All right? Have fun. Good luck. And here is to smoother births and faster recoveries. Take care, everybody. Bye-bye. Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code podcast50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.